Welcome to Body Solutions, where total physical fitness is directed by a physical therapist. Today I'm going to talk about osteoporosis and what physical therapy can do for you if you do have osteoporosis. Now, of course, most people realize that with osteoporosis, you want to do an exercise program that builds your bones to the full extent as much as possible. Now, depending upon where you have your osteoporosis, and the most common places include your hips and your back, that would dictate what exercises that you have precautions with and what exercises you should not do. In general, a physical therapist should be designing a program for you that helps you rebuild your bones without injuring your body parts. Now, it's very common that a lot of commercial fitness type exercises that are really bad for you, we commonly see in physical therapy clinics. Of course, in gyms, personal trainers will be utilizing them to help you strengthen your body. Some of those common exercises that are bad would include sit-ups, the Superman, which I'll demonstrate, wall slide squats, where you slide your back down the wall to try to strengthen your legs. The reason that's bad is because it puts a lot of rubbing forces in your knee. Your knee is designed to pivot, right? So when you slide down the wall, just because you can use a lot of the muscles in the front of the thigh and none on the back because you're leaning back, what it does is it causes the knee to slide inside. And what it does is it creates more rubbing or more friction in the knee. The other way to word that is it accelerates the joint degeneration because there's more friction. It's wearing away the cartilage. Okay, so there are also common bad exercises for the shoulder, such as an upright row, going like this. What it does is it pinches two bones together in the shoulder. In between those two bones are a lot of soft tissues, like a bunch of tendons basically, and they can be damaged. But the most common no-no exercises that we see in the gym are sit-ups. The reason you don't want to do sit-ups, especially if you have back osteoporosis, is because it puts a lot of pressure in the back while it flexes or bends the back. Okay, so how much pressure? I've been explaining to patients for years now that it's about 750 pounds of pressure. And I usually get this blank stare. I recently started using the analogy of imagine two large NFL linemen standing on your back. That's about how much pressure is going down your back when you're doing a sit-up. So 750 pounds, two large NFL linemen compressing your back while you're taking your back and doing this. And what's even worse is the Superman. The Superman, which I'll demonstrate, is over 1,100 pounds of pressure. So probably 3.5, maybe 3 heavy guys, maybe 3 linebackers and 1 quarterback on your back and having your back compress. Okay, in fact, there's been documented cases of compression fractures with this Superman exercise that I see all over the internet, touted as a good lower back strengthener. Okay, so again, you do not want to compress your spine with 750 to 1,000, 1,100 pounds of pressure and have your back move. Why? Because those joints are taking a beating. And unfortunately, at least in this year, they haven't figured out how to regenerate your back yet. You only have one back, so you want to treat it with care. So the goal is to build the muscles around it without having to cause too much strain or too much compression down the back. So, of course, everyone knows a sit-up, but the Superman would be going on your stomach with your hands and legs lifted up at the same time. Okay, so from a side view, you can see that. That's a Superman exercise, and it's pretty bad for your back. So I would highly recommend sticking to an exercise program that involves functional exercises, such as regular squats, picking something up from the floor, these types of exercises. That builds your hips. It works on the hip muscles, which helps deposit bone density in your hips. If you want to work on your back, do planks, leaning against the table or on the floor with your spine perfectly straight on your side. Or you can do it forward, like this, keeping perfect posture without the back moving. With the plank, you're still going to get the compression, but yet it's compression without a lot of movement, repeated movement like the sit-up. You definitely want to stay away from those exercises in the gyms where you extend your back for your lower back and you crunch to try to work your abs. Those exercises are, in general, bad for your spine. Okay, so try to pick a good exercise program If you're lost, you don't know how to formulate a program, feel free to contact us. In fact, if you have osteoporosis, a prescription from your doctor will cover physical therapy for us to show you a safe, comprehensive program that will help deposit more density, more calcium in your bones to rebuild your bones. So feel free to contact us. We'll give you all the information you need to get you started to try to rebuild your bones, ideally without the medications. There's a lot of alternatives that you can do. We've had many patients rebuild their bones back to normal with no medications with a proper exercise program.